Lung diagnosis for chronic cough. After having severe pneumonia as a child, Mrs. B suffered from a mild form of bronchiectasis. The 50-year-old patient had a chronic cough with copious green-yellow sputum and reported that she always felt its presence in her lungs. She had a tendency to catch colds during the autumn and winter. Bronchiectasis is a condition where damage causes the tubes in your lungs, the airways, to widen or develop pouches. It makes it hard to clear mucus out of your lungs and can cause frequent infections. Coughing a lot with pus and mucus is the main symptom of bronchiectasis. Bronchiectasis can't be cured but can be managed with treatment. 1 year ago, a benign tumor of the parotid gland was diagnosed, which at the time of treatment measured 3 cm by 1 cm. The tumor was of a firm, rubbery consistency, although it caused no pain. In general, the patient felt well. Her menopause had passed without incident. The tongue body was pale and had deep red points, plus a depression in the anterior third. The center and posterior third of the tongue had a dark yellow coating. Her pulse was confined and slippery. As a result of the chronic cough, lung qi had lost its root, which led to lung qi deficiency. This was reflected in the depression in the anterior third of the tongue, which suggested deficiency of the gathering qi and lung qi. This weakness also contributed to her tendency to catch colds. Mrs. B also suffered from long-standing clumping of phlegm heat in the lungs that was responsible for the expectoration of green-yellow sputum. The heat was reflected in the deep red points on the tongue. The chronic phlegm heat in the lungs interfered with the downward directed action of the lung qi and gave rise to the chronic cough. Before treatment with Chinese medicine began, Mrs. B ate a vegetarian diet with a lot of raw foods and dairy products. This weakened the spleen qi and was responsible for the formation of internal dampness. Her protective qi was weak, as evidenced by the frequent invasion of wind cold in the autumn and winter. The pathogenic factors constrained the lung qi, which quickly transformed into heat. Because of the underlying accumulation of dampness and phlegm heat in the lungs readily formed and continuously fed the persisting pathology. The coating on the anterior third of the tongue, which corresponds to the lung area, was thin and showed a depression. Thus, the tongue only showed the deficiency of lung qi. The presence of phlegm in the lungs, however, was not visible on the tongue. The yellow coating, indicating the presence of accumulated damp heat, was located at the center and the posterior third of the tongue. This confirmed the underlying involvement of the spleen in producing dampness, especially as the center of the tongue body was also slightly swollen. The yellow color was indicative of the transformation of dampness and phlegm into phlegm heat. A similar pathology was responsible for the formation of the tumor in the parotid gland. The inability of spleen qi to transport and transform dampness led to an accumulation of phlegm, which interfered with the flow of qi. The phlegm in this case coalesced into a knot, a tumor. The rubbery and firm consistency of the tumor, as well as the firm, slippery pulse, corroborated this finding. The aim of treatment was to clear the heat from the lungs, transform phlegm, regulate the lung qi, and soften and dissipate the tumor. The patient was advised to abstain from raw foods and dairy products. Over a period of 4 months, the patient was prescribed a modified combination of Fritillaria and Trichosanthis fruit powder and Sargassum decoction for the jade flask. Ingredients included Bulbus fritillariae thunbergi, Fructus trichosanthis, Radix trichosanthis kirilowi, Sclerosium porreococcus, Radix scutellariae bicalensis, Herba sargassum, Phallus algae, Rhizoma pinelliae ternate, Radix angelicae sinensis, Pericarpium citri reticulate, Fructus forsythia suspense, Radix glycerice uralensis, and Massa fermentada. Following this treatment, and for the first time in her life, Mrs. B did not catch cold in the autumn or winter. The cough was noticeably lessened and the expectoration reduced. The sputum was now a pale yellow color. The tongue shape and color had likewise improved. The depression in the anterior third of the tongue was no longer visible, and the coating was normal. The latest examination by ultrasound showed that the tumor had decreased in size by 1 centimeter and felt softer. As Mrs. B tolerated the herb so well, the treatment was continued for a few more months. Thank you for your attention.